Everyone, my name is Evina, and our group will be presenting about beautiful bulk flowable. So I will talk about the major uses of this dental material, and then we'll discuss its improved features, important factors to consider, as well as competition, recommendations, and age of the product. So here you can see that it comes in the form of syringe, since it's a low viscosity bulk fill composite. It's indicated for use as a base or liner in class 1 and 2 restorations. It comes in two shades, universal and dentin, and they have different curing times for each shade. Here you can see the image of it being used for class 2 cavity, but it can also be very beneficial for deep posterior restorations since it provides low sensitivity. It offers a variety of improved features, which we will talk about during this presentation. It allows for faster and simpler restorations, which makes your job a little bit easier and your patient happier. And it can also help to prevent secondary caries and increase remineralization. It can be used as part of Beautifil bulk restorative technique together with composite material for a larger occlusal restorations, especially in posterior teeth. And this allows for this allows to give flexural strength and compressive strength to your restorations, since it's especially important for posterior teeth that experience a lot more force than other teeth. And also due to its properties and that are listed here, you can see that this material allows to deliver great aesthetic results, which again will make your patient happy.
And I'll be discussing some of the improved features of Beautifil Bulk Flowable. So one of the main features is that it has a filler composition of about 72.5% by weight. And the main filler present is a geomer, which has a resin base with pre-reacted glass ionomer technology. So what does this mean? Well, as we learned in lecture, fillers have control over increasing mechanical properties, and because it has a high percentage of filler present, there will be less shrinkage of the restoration, while also being able to increase the compressive and flexural strength. Further, because of the resin content, it has a very low viscosity, which allows for the restoration to stay in place, self-level, and internally adapt to existing tooth structure. Additionally, Beautifil Bulk Flowable resin chemistry allows for light to penetrate deeper for curing without incorporating bubbles or voids. And this can be seen a little bit on the image here in the bottom. Right there. So how is this beneficial for the dentist and the patient? Well, for the dentist, restorations can be completed a lot faster because there's no need for incremental layering due to the light being able to penetrate deeper. Also, because no layering is required, less instrumentation is needed in order to complete the restoration. I also mentioned previously that the restoration is less prone to shrinkage, which is beneficial to both the patient and the dentist because the restoration is not as likely to be repaired or redone in a few years' time. We also learned in lecture that glass ionomers contain fluoride, and this can be beneficial to the patient because secondary caries are less likely to occur as compared to a restoration that doesn't have fluoride.
Hi, my name is Shyam, and I will be discussing the clinical indications of bulk flow. So some of the different ways you can use it is as a strong base in class 1 and class 2 cavities, as a liner under direct resin restorations, in small posterior restorations, undercutting blockout, minor repair of defects on direct minor repair of defects on direct resin restorations, and restoration of deciduous dentition. Some of the important factors to consider from a dentist perspective is that this product is visibly light cured, and there's a depth of cure of up to 4 millimeters. And from the patient's perspective, there are different shades to get the perfect match. The contents of the product are bis-GMA, UDMA, bis-MP, EPP, TEG-DMA, SPRG filler based on fluoroborosilicate glass, and polymerization initiator, and some other pigments and other things.
Hi everyone, my name is Dharmshah, and I'm here to talk to you all about Beautiful Bulk Flowable versus one of its competitors called Filtek Bulk Fill. So, in terms of prices, Beautiful Bulk Flowable, you can get 2.4 grams syringe for about $40, which differs from the Filtek Bulk Fill, which you can only get 2 grams syringe for about $50. The unique ingredient that the Beautiful Bulk Flowable tends to market is a geomer glass filler, which they say has been tested clinically for the last 13 years and has granted excellent results. This differs from the unique material that the Filtek Bulk Fill tends to market, which is their Filtek Matrix system. Beautiful Bulk Flowable is bis GMA based, while Filtek Bulk Fill is UDMA based. Beautiful Bulk Flowable has a depth of cure of 4 millimeters, which is 1 millimeter less than the depth of cure that you can get with Filtek Bulk Fill being 5 millimeters. However, Beautiful Bulk Flowable has lower shrinkage stress as well as a lower volumetric shrinkage than Filtek Bulk Fill. One of the downsides of Beautiful Bulk Flowable is you can only get 2 shades, being Universal and Dentin. And Beautiful Bulk Flowable tends to mainly be meant for the posterior teeth. Filtek Bulk Fill tends to have multiple shades offered, 5 being specific, and can work for both anterior as well as posterior teeth. So those are the main differences between these two products. As you can see, they are similar, but also very different in which ingredients they use and also what situations they can work for. So there are advantages to both. So these are just the main factors that I believe are the most important to consider when looking at these products.
So here's our overall recommendation for the material. The Beautiful Bulk Flowable stands out for its impressive flowability, allowing for easy adaptation for cavity walls. The high radiopacity enhances the diagnostic accuracy as well. And along with this versatility, it makes it very suitable for various dental applications. And in the general clinical realm, the material excels aesthetically, providing an overall natural look. And it also has low invasiveness, which preserves the natural tooth structure during procedures. Efficiency is also a major thing in dental practices, and this material addresses this need with its quick curing time. It's also very cost effective when comparing it to other materials, and the continuous research for this material provides some insight into its long-term performances. And on the right side, I included 2 images. The one on the top shows various positive reviews that other dental practices have provided for this material. And the one on the bottom shows the Beautiful Bulk Flowable compared to other dental materials. And you can kind of see that 37% think that this material is better, and 30% think it's equivalent to other materials. And this just talks about the age of the product. So this type of material was introduced to the market in 2009. And it has been clinically accepted for the past 13 years due to its geomer filler technology. And that's it. Thank you, everyone, for listening to our presentation.